Hey there, it's the Medicare lady. I have a few quick thoughts about what it means to be a veteran and on Medicare. Oftentimes when people are veterans and they are on Medicare, they may not be aware of the benefits that you get by using your VA benefits. So meaning that you go to the VA hospital or you use a VA doctor to prescribe certain medications that you may not otherwise be able to afford. This is something to look into because if you don't have credible drug coverage, you may be accruing what is known as a Part D penalty. What's a Part D penalty? So Medicare Part A and B, Medicare Part A being hospital, Part B being medical, is just for hospital and medical. It doesn't actually provide you drug coverage, which is known as Part D. So if you're outside of the annual election period, which is October 15th through December 7th of every year, you need to have a special election period to get enrolled into a prescription drug plan. A lot of times people don't have that. So there they are with Medicare Part A and B, no credible drug coverage, no election period to be able to get into plan, but they're a veteran. So that means that they do actually have access to credible drug coverage through the VA. That's a possibility. So that means that even if you didn't retire from the military, so that means you don't have TRICARE for life, but you were a veteran, then by using your VA benefits through a VA doctor, you may be able to get those same prescriptions that you would otherwise pay a lot of money for an extremely affordable price. What if you're far away from the nearest VA hospital? The VA has made great strides to make it easier and accessible to be able to talk and communicate with the VA doctor from a totally different location, remote area even. You'd be able to communicate with your VA doctor through systems that they have set up for it. Now, I'm not the VA. I'm obviously not working in the VA right now, but I do know a lot of veterans who are on Medicare that benefit by everything that they provide. So if you are a veteran or think you may have eligibility for veteran benefits, contact your VA office, contact your local VA, even if it's 100 miles or 200 miles away. They may be able to provide you with accommodations for when you are able to get to the VA hospital. You could even ask them if they'll help you with transportation to get there if that's an issue. There's a lot that's out there for resources to help our veterans. And another key point is that if you're on Medicare, rather than continuing to accrue a Part D penalty, why not check into the VA benefits that may provide you what is known as credible drug coverage while you're on Medicare that protects you from the penalty, as well as provide you with prescriptions for a really affordable rate. So these are all things that could really help. You can find out more information through the veterans website by calling the VA or by calling 1-800-MEDICARE. Now, they may not give it to you in a nutshell like I just have, so definitely research it more. Just want to make sure that all of our veterans that are on Medicare know that there's a lot of different possibilities out there to make sure that they get the care they need. Until next time, take good care.